study video as an ED.
All right, here we go. This is Dr. Andy. He's going to talk to us a little bit about the FLA-MOM and give us some insight.
So this is what happens when a best laid plan starts getting implemented and it takes different tracks. So we started this off as an emergency department diversion avenue to track the demographics that we have here. We are going to track the demographics of the patients, compare it to the ED utilization, because that's most of the questions on the impact study. And then we're going to look at the care they receive. Basically, we track it by numbers, no names. The care they received, what they did get received, and then, since through AHCA, Area Healthcare Administration, they can then track retrospectively. All the hospitals have to report their numbers. So our initial premise was, we're going to track the numbers over a 6-year retrospective side, 6 months retrospective. After our admission of emergency, was there a blip, up, down, or otherwise, in the care needed at the EDs or the utilization of the EDs, and subsequently did it go up or down after that period of time? Thinking if we did definitive care, it may in fact drop the numbers going to EDs. We're just getting those numbers put together a year and a half later, because it's 6 months out. Now we've got the data, we're going to put that together. But what it did do is it took us in another direction completely. Simply having the data is the name of the game. It doesn't matter what the outcome is of the EDs. Patients are not going to make informed decisions anyway. The data has given us metrics on zip codes, needs in zip codes, income levels, income disparities through the CRA, since the Community Reinvestment Act requiring, which is a federal requirement for all financial institutions. We are the only ones that have data showing that X number percentage or X number percentage up or below the poverty line. They have to do that every year. It provides instant funding and volunteers, because they can do it either way for your events. It supports them right from the bat. But taking it to legislators, you cannot beat it. They can never argue data. We've had feedbacks we've had fill-outs of the forms, scientifically so, through an IRB. We are going to happy scientific method. We'd be lucky at about 16% return. We've had over 60% return, and most of those were only disqualified because the signature wasn't done correctly or one question wasn't answered. So with care, we had over 70+% responses on these. We can do multivariate analysis by zip code, income stream, age, gender, economic status, employment status, and it's just intriguing what you can show to then subsequent nonprofits and how you can move this forward on the needle to all the local areas of care. The FQHCs now get involved because now they know the parameters of the income levels they're working with. Now they create elevated income amounts or cost amounts, and there's so many changes that can be made over that. And we haven't even gotten to the ED referral side. It's purely on having the demographics and why you do it. The implementation is something that we are willing to share, and we did share with every Mission Emergency event. You do not have to be computerized to do it. All the materials we gave can be done in paper, but at some point the numbers have to be crunched. To be able to do it on site is just so simple, especially if you're going to be integrated with other aspects of the routing of the actual clinic itself, which I would strongly suggest. If you have a wonderful technology team, we're happy to tell you all the parameters of what you're going to need. But we've been blessed with that, and we've really defined it over the last 3 events to make it almost seamless, as well as you can be. But what started out as simply an ED study has taken a whole new life of itself, and it has basically opened up whole doors to funding sources, nonprofit for local community changes, and bringing people out of the woodwork that are all trying to make changes in access to health care realized.
Wow. Thank you very much.
I don't know if that helps.